It's that time of year where we pack our most dust-proof costumes, food, water, shades, and plenty of soap and shampoo. Why? Because we're off to soak up desert sun and good vibes at the sketchy renowned Shaking Man Festival. It's not called Shaking Man just for the shake of it. We're here to explore the world of broad-spectrum anti-epileptics. Epilepsy is a chronic disorder characterized by recurrent seizures caused by the abnormal discharge of cerebral neurons. Seizures can be hereditary or may be due to other causes, including infection, neoplasms, or trauma. The important thing to understand is that not all seizures are the same, and picking up on key facts in the patient's medical history will cue you in to which anti-epileptic is most suitable. Depending on where in the brain they originate, seizures are generally divided into two main categories: focal onset, formerly partial, and generalized. If the origin of a patient's seizure is not clearly focal or generalized, it can be categorized as unknown until identified as either focal or generalized. Speaking of focal, our festival goer here is really focused on shaking that one arm as the music echoes across the playa. Focal seizures are subclassified depending on the patient's awareness. If the patient is aware and conscious, this seizure is a focal aware seizure, even if the patient is unable to talk or respond. This was formerly known as a simple partial seizure. If the patient has impaired awareness, the seizure is a focal impaired awareness seizure, even if the patient can remember some aspects of the episode. This seizure type was formerly known as a complex partial seizure. We can further classify focal seizures according to whether they involve movement. Focal motor seizures involve some sort of movement, from mild twitching and lip licking to jerking and stiffening. Focal non-motor seizures begin with changes in cognition, emotions, and/or sensations. It's not Shaking Man without a giant shaking man, right? Our whole body shaking man depicts generalized seizures. Generalized seizures involve both hemispheres at onset. Like focal seizures, generalized seizures can be classified according to the presence or absence of movement. Generalized motor seizures include tonic-clonic and myoclonic seizures. Tonic-clonic seizures involve stiffening, tonic, and jerking, clonic. Myoclonic seizures present as transient, shock-like jerks of a muscle or muscle group. Generalized non-motor seizures are mainly absence seizures and involve transient changes in awareness. Staring and automatic movements, like lip smacking, may occur. Oh, and keep in mind that focal seizures can become secondarily generalized and turn into a tonic-clonic seizure. Pharmacologically, most drugs used to control partial seizures can also be used to control these generalized tonic-clonic seizures. As you can see, there are different types of seizures, but luckily, broad-spectrum anti-epileptic agents have got most focal and generalized seizures covered, just like the serious coverage provided by these rainbow spectrum goggles. I think we can all agree, dust in the eye is not a vibe. Alright, goggles in place, let's look at our first broad-spectrum anti-epileptic, valproate, also called sodium valproate or valproic acid. This drug has multiple mechanisms of action and is effective for all the seizure types we just mentioned. The sign welcoming you to Shaking Man Festive Val should help you recall valproate. Uh-oh. Hope everyone packed enough food, because salty peanuts, our recurring symbol for sodium, and Calci-Yum ice cream, our symbol for calcium, are already sold out. You may even say they're blocked? Blocked indeed. Valproate works by blocking use and voltage-dependent sodium channels, thereby preventing the sustained high-frequency firing of neurons. Valproate extends the inactivated phase of these channels. Note that this binding occurs at a different site from carbamazepine or phenytoin. It's also important to remember that valproate blocks T-type calcium channels. Did someone hail a cab? GABA? Get it? Okay, hailing a cab might be so 90s, but Remember that GABA is a major inhibitory neurotransmitter, and valproate may enhance GABA release by a presynaptic effect on GABA B receptors. However, it has no apparent effect on GABA A receptors. Valproate also inhibits nerve terminal GABA transaminase, GABA T, that breaks down GABA, thus leading to increased presynaptic GABA levels. Finally, valproate may also increase synthesis of GABA by activating glutamic acid decarboxylase, or GAD. Ooh, this guy's not looking so great. Think he's been shaken a little too hard. The most common side effect of valproate therapy is GI distress, including nausea and vomiting. Valproate can be taken with food to reduce nausea. It's a pity they're all sold out, though. Valproate can also cause increased appetite and weight gain, so patients should be advised to monitor their diet to avoid unwanted weight gain. The helpful assistant straining to lift the heavy box of DJ equipment is a reminder of weight gain as a side effect. Good thing the speakers were airlifted in. At higher volume, or drug levels, valproate can cause a fine tremor, kinda like our tremoring antenna here. Another side effect of valproate therapy is rare, but possibly fatal: hepatotoxicity. And with that one-of-a-kind liver-shaped fanny pack, how could you forget that? Although routine monitoring of liver transaminases does not predict hepatic failure, measuring LFTs before treatment initiation and frequently thereafter, especially during the first 6 months, is still recommended. Advise patients to immediately report symptoms indicative of severe hepatotoxicity, such as rash, fever, abdominal pain, vomiting, jaundice, bruising, or bleeding. Maybe dusty in these parts, but at least this cab is getting a wash. We've included ammonia cleaner, our recurring symbol for hyperammonemia, as a reminder that valproate can cause varying degrees of hyperammonemia, from asymptomatic to hyperammonemic encephalopathy. And to really scrub those windows clean, we've added in a squeezed pancreas sponge. Yeah, valproate can also cause acute pancreatitis, though this side effect is rare and not related to dose or duration of valproate therapy. Okay, before we move on to other meds, one more critical note. Valproate has been associated with major fetal malformations, including neural tube defects like spina bifida, as well as orofacial clefts and cardiac, urogenital, and limb defects, and therefore is avoided during pregnancy and individuals of childbearing potential if possible. Due to this teratogenicity, we've included our recurring teratogenic tarantula. There's definitely a lot going on at this festival. But hold on to your toupee, because next we'll take a look at topiramate. Topiramate is effective against many of the seizure types we've discussed previously, including focal, generalized, juvenile myoclonic, and possibly even absence seizures, though it's not as effective as valproate or lamotrigine for managing absence seizures. Note that topiramate can also be used as migraine prophylaxis. Like valproate, topiramate works by inactivating sodium channels, blocking the sustained high-frequency firing of neurons. Think of these locked and blocked boxes as salty sodium peanuts. Like valproate, topiramate also potentiates the inhibitory effects of GABA, but this time by binding to an allosteric site on the GABA A receptor. Note that this allosteric site is not a benzodiazepine binding site. Our toupee-wearing reveler is in the passenger seat of the cab A pedicab, which should help remind you of that allosteric binding. So that's why the pedicab is out of control. The driver is catching some Z's after a long night of dancing. Link this to common dose-related adverse effects of topiramate, including somnolence, fatigue, confusion, and impaired concentration. Weight loss is another common dose-related side effect of topiramate. In fact, topiramate is used in combination with phentermine for weight management. So, this driver isn't exactly driving, but hey, we can't place all the blame on him. Those kidney-shaped wheels weren't made for maximum pedicab control. They're also a reminder of another possible side effect of topiramate therapy: urolithiasis, better known as kidney stones. Adequate hydration can help prevent kidney stones, especially in patients with a prior history of them. And finally, topiramate has been associated with acute myopia and acute angle closure glaucoma. If this reaction is suspected, for example, if the patient is experiencing decreased visual acuity or ocular pain, topiramate must be ceased immediately. That creepy-looking bulging eye balloon is pretty unmissable, so we'll help you recall acute angle closure glaucoma. But we can't guarantee it won't haunt your dreams. Moving right along. Shaking Man Festival is not complete without a slobbering lamotrigine llama. Lamotrigine is effective against many of the seizure types mentioned, including focal and generalized seizures, and seizures associated with Lennox-Gastaut syndrome. There's also some evidence for efficacy against absent seizures, though it's less effective than valproate and ethosuximide. Turns out those peanuts are popular. Our lamotrigine llama wants in on that blocked and locked box of salty sodium peanuts, so that's why they lock them. Like both valproate and topiramate, lamotrigine works by increasing the inactivation of sodium channels, thereby blocking the sustained high-frequency firing of neurons. There's also evidence that lamotrigine may modulate presynaptic transmitter release of excitatory amino acids like glutamate and aspartate. A common side effect of lamotrigine is diplopia and blurred vision, symbolized by our cross-eyed glasses atop our llama's head. The major adverse event to look out for? Skin rash. 10% of patients taking lamotrigine will experience a benign maculopapular rash. However, around 0.8% of children and 0.3% of adults will develop life-threatening Stevens-Johnson syndrome. Drug reaction with eosinophilia and systemic symptoms, or DRESS, can also occur, though this is rare. Note that lamotrigine elimination is impacted by concomitant valproate use. Valproate inhibits the metabolism and elimination pathway of lamotrigine. Decreasing the dose of lamotrigine when used with valproate can reduce the risk of lamotrigine toxicity and adverse effects. All right, Festival, Toupee, and Llama in place, there's one more anti-epileptic drug class to sketch in. The racetams. Levetiracetam is symbolized by our elevator, taking revelers up to the zip line. Levetiracetam is approved as an adjunctive therapy for focal onset, primary generalized tonic-clonic seizures, and myoclonic seizures in children and adults. By adjunctive, we mean it's added on top of other anti-epileptic drugs to allow the patient to achieve control of seizures. And look who's up top, our brave brivaracetam zipliner. Brivaracetam is a new drug in this class and can be used alone or as an add-on for focal onset seizures in patients 4 years old and up. Note that brivaracetam is indicated for fewer types of seizures than levetiracetam, and isn't considered as broad spectrum as our other drugs in this sketch. While the exact mechanism is unknown, levetiracetam and brivaracetam bind to synaptic vesicle glycoprotein 2A, SV2A. Our friend here was so eager to ride that zip line, but his dizziness and weak stomach got the better of him. Some of the most common side effects of levetiracetam and brivaracetam are dizziness, sleepiness, and nausea. Hold on to that falling brain hat. Levetiracetam is commonly associated with neuropsychiatric effects like depression, hostility, aggression, and agitation. This may lead to patients stopping therapy. These effects are more common in patients with a history of psychiatric problems or learning difficulties. Levetiracetam is really useful because it's metabolized independently of the CYP450 enzyme system, so the risk of drug-drug interactions is reduced. Brivaracetam, on the other hand, is partially metabolized by CYP450 enzymes. If administered with anti-epileptic drugs that induce CYP450 enzymes, like phenytoin, carbamazepine, or phenobarbital, serum drug concentrations of brivaracetam may decrease. Our brave reveler has fashioned some post-apocalyptic shoulder plates from a P450 license plate, our recurring symbol for CYP450 enzymes. As the sun sets on another successful Shaken Man Festival, remember the main players in the broad-spectrum anti-epileptic space. Valproate, also known as sodium valproate or valproic acid, can be used in the management of focal and generalized seizures, as well as a mood stabilizer in bipolar disorder. Topiramate and lamotrigine are also used for focal and generalized seizures, Lennox-Gastaut syndrome, and absence seizures. And finally, the racetams. Levetiracetam is used for focal and generalized seizures and myoclonic seizures, whereas brivaracetam is used primarily for focal onset seizures, and therefore isn't considered broad spectrum in the same sense as our other anti-epileptics in this sketch. Look, it's definitely time to dust off the dust and get back to civilization. Hopefully we're not all relying on that llama.